Good morning. Hello. I think I'm live. I am live. Hello, hello. Good morning. Sorry, I'm clicking around here to make sure I'm not muted or anything. Okay. Hello, good morning. I am continuing my series. On why what you're doing right now isn't working for you and your pain. And today is day 4 of 5. So I will wrap up this series tomorrow. So why what you're doing isn't helping your pain right now. And today I'm talking about pills and supplements. So pills being prescription medications, supplements being pill supplements, whether it be over the counter kind of thing. Actually, pills would be more over the counter and medication. And then supplements are, the vitamins and minerals and any supplements you buy from another company, group, whatever. So why what you're doing right now isn't working, pills and supplements addition. So I have a couple of things. I have 6 things. And actually it's 5 things. I can't count. Sorry, guys. I don't know where my brain is this morning. Anyway, it's 5 things why your pills or supplements aren't working right now and to help with your pain. And the first one is you're taking the wrong one. You're taking the wrong pill or supplement. I usually find this with prescription medications or over-the-counter medications. Most of my clients don't really talk to me about what supplements they're taking, whether they think they're taking the wrong one or not. I hear most often about medications and over-the-counter pills. So that's mainly what I'm going to talk about, but the same thing can happen with the supplements, vitamins and minerals that you also take. So taking the wrong pill. What's an example of this? So the number one pill that I hear somebody's taking for their pain, which can help with pain, is Tylenol or acetaminophen. So Tylenol is the brand, acetaminophen is the generic. Why wouldn't that work? Well, if your problem is an inflammatory problem, an inflammation problem, a chronic inflammation problem, a swelling problem, a systemic inflammation problem, Tylenol will not touch it. I will say that again. If your problem is inflammation, Tylenol will not touch it. So if you're taking Tylenol for pain, yes, Tylenol is a pain reliever. It is not an anti-inflammatory. It is not an NSAID, a non-steroidal anti-inflammatory drug. It does pain relief, fever relief. Those are the 2 main things that it does. It does not touch inflammation. It does not work at the inflammatory markers. If you're taking Tylenol for pain, but your pain is originating because of inflammation, Tylenol will not touch it. So you would want to take an NSAID instead. So I can't tell you which ones to take, but you can look up what NSAIDs are, non-steroidal anti-inflammatory drugs. Those are for inflammation. So that's the number one that I hear. And then another one that I hear people will take are some kind of opioid. And that could be an oxycodone. That's a common one. That's an opioid medication that also is not an anti-inflammatory medication. You could be taking a combination of oxycodone and acetaminophen, which would be hydrocodone. Those will help with pain. If your problem is from inflammation, the opioids will not touch it. They are not anti-inflammatory. They might dull up the pain a little bit. They will most likely just give you the side effects, being dizzy, knocked out, feeling drugged up, but they're not anti-inflammatory. So if you're taking an opioid for an inflammatory problem, it doesn't really touch it. Dulls it up a little bit, makes it so you can sleep probably, but it's not an anti-inflammatory. So acetaminophen is not an anti-inflammatory. The opioid, not an anti-inflammatory. Another one that I hear people taking would be like a Neurontin, or, oh, the name of it, Lyrica. Those help nerve pain. So could your nerve pain be from inflammation? Sure. But it could also be just nerve pain, not caused by inflammation. You know, you have a neuropathy, you have diabetic neuropathy, polyneuropathy, chemo-induced neuropathy. Doctors tend to prescribe like a Neurontin, a gabapentin, a Lyrica for that kind of pain. If your problem is inflammation, those medications will not touch it. Those will touch neuropathy related pain and problem. And so, sorry, I got distracted. I got a text message, even though I have do not disturb on. That was confusing. So anyway, so taking the wrong pill or supplement. So acetaminophen, not an anti-inflammatory drug. Opioids, not anti-inflammatory drugs. A Neurontin, a Lyrica, those are for neuropathy, not anti-inflammatory drugs. So if you're taking the wrong pill, but your problem is, if you're taking a pill, but your problem is inflammation, chronic inflammation, then those kinds of pills won't help. Okay, so that's reason number one why your pills or supplements aren't working. Reason number two is you've been on the medication for so long that you've built up tolerance to the medication. So you need to take more and more and more of it, but you've maxed out. So it was working, but now your body has become so used to it that you need more and more and more, and you've maxed out on the amount that you can safely take. So it might not be working anymore because there's just not enough of that medication going into your body. You know, it's the best comparison I can give it to for a tolerance thing is alcohol, right? This is an easy thing for us to think about. Alcohol, when we first start drinking alcohol, half a beer and you feel drunk. You keep doing that enough, before you know it, it's a beer and 2 beers and 3 beers and 4 beers and however many beers you're drinking before you can feel the effects of the beer. Same thing with pills, medication, supplements, things like that. You need more and more and more of it to feel the same effects. Okay, so if you've been taking a medication for a while, you might have maxed out, built up too much tolerance. You might need to change to a similar yet different medication to get the effects that you used to get. So that's reason number two. You've built up tolerance to that pill and you've maxed out on how much you can take of that pill. Number three reason why your pills might not be working for you are that the side effects actually come on sooner before the medication can even work. Many prescription pills and over-the-counter pills, they have not pleasant side effects. You know, maybe it's making you dizzy or it's making you too sleepy and you get knocked out before you even feel the pain relief benefits of it. So that could be why it's not working, because the small dose that you're taking or the dose that you're taking, the side effects are too strong for the results of the medication. So that's reason number three, is that the side effects just kick in for you too soon. And that can happen with brand versus off-brand medications, because the difference between those are inactive ingredients. So the active ingredients, the main one that's doing the work, but you can also have inactive ingredients that aren't doing as much of the work, but they can contribute to side effects. So you might need to try brand versus generic for something to get fewer side effects, but to get the benefit of the medication. So that's reason number three. Reason number four is you're being reactive and not proactive. So what do I mean by that? You're being reactive in that you are taking an anti-inflammatory drug, an aspirin, an Advil, a Motrin, an ibuprofen, something like that. And those diclofenac, which is a prescription level anti-inflammatory, you could be taking those and it's not working because you really needed to do more prevention as opposed to damage control, so to speak. You know, maybe you waited too long. You thought, oh, you know, I bumped my elbow. I'm just going to let it, it's not that bad. I'm just going to let it ride out. 2 weeks go by and it hurts like crazy. Now you're taking anti-inflammatories, but it takes days for the anti-inflammatory effect to take effect. So now you're in agony because it just hurts so much. Whereas being proactive in this scenario, you could have taken the anti-inflammatory right away, prevented the inflammation from coming on from the get-go. So that's one way. You could take an anti-inflammatory, a Motrin, as soon as the bump happens, prevent the inflammation from coming on. You could also prevent the inflammation from coming on by changing what you're eating every day. You know, not eating so many bad fats, right? Not eating as much sugar, not eating as much processed food, eating more whole fruits and vegetables and protein sources, things that haven't been overly manufactured and processed. Those are ways that you could proactively prevent the inflammation from coming on instead of having to do damage control later and take all of the Motrin to calm down this inflammation that is now running its course through your body. So that's reason number 4. I really can't count today. Reason number 4, that your pills or supplements aren't working. You're being reactive and not proactive, and it's too late. Then the last one is you may not be taking complementary pills or supplements for that pill. What do I mean by that? The best example I can give is not an anti-inflammatory example. This is just the one that comes top of mind, but it shows you that some medications need something else to help it do its thing. Actually, I'll give 2 examples. So the first example is if you need to take iron supplements, which actually lack of iron can create pain and inflammation. So this actually is a pretty good example. So not taking, if you're taking an iron supplement, did you know that iron is best absorbed in your body with vitamin C? If you're not taking or ingesting vitamin C regularly and you're taking iron pills, your body doesn't know what to do with the iron and you just pee it out. So you need to take vitamin C either through a vitamin C supplement or through eating citrusy fruits or red and orange vegetables. So bell peppers, those are good examples of getting some good vitamin C. And then another example is calcium, taking a calcium supplement. If you're not taking a vitamin D supplement or getting enough vitamin D, your body doesn't know what to do with the calcium. So your pills may not be doing their thing. They may not be working because your body doesn't know what to do with the product. It doesn't know what to do with that chemical. It doesn't know what to do with the calcium if you're not taking vitamin D. It doesn't know what to do with the iron if you're not taking vitamin C. You can ingest it all you want, but if your body doesn't know what to do with it after that, the pill isn't going to work. So those are 5 reasons why what you're doing right now, taking pills or supplements, aren't working for you. So you're taking the wrong pill or supplement. The side effects come on too soon for the good effects of the pill or supplement. You've built up tolerance. You've maxed out the amount of that pill or supplement you can take. You're being reactive and not proactive. You're not preventing the inflammation from coming on by eating a whole foods diet and less processed foods from the beginning. And you may not be taking the complementary pills or supplements so that your body knows what to do with that pill or supplement that you're taking. So that's all for you guys today. I'll come back again tomorrow with the last of this series on why what you're doing right now isn't working for you. And as always, comment below or send me a private message with questions you have that you want answered. All right, I'll see you guys soon.